Back in the chapter of health programs in India, in today's session we will discuss about Chikungunya fever control program. Under the National Vector-Borne Disease Control Program, which is an umbrella program for the prevention and control of 6 vector-borne diseases. The National Vector-Borne Disease Control Program is aimed at prevention and control of 6 vector-borne diseases. They are namely malaria, lymphatic filariasis, dengue, Japanese encephalitis, Kala Azar, and Chikungunya. In the previous videos, we have discussed about all the 5 vector-borne diseases. In today's session, we will be discussing exclusively about Chikungunya control program. Chikungunya fever is a debilitating non-fatal viral illness. It is a very debilitating. Debilitating is the one which makes the person completely exhausted and fatigued. Non-fatal viral illness. It is non-fatal. Non-fatal in the sense the death out of it is very, it's not a disease which causes death. Okay, it is non-fatal. Viral illness caused by a virus re-emerging in the country. So chikungunya was present and then it was almost eradicated, and now it has again re-emerged. So it is a re-emerging illness in the country after a gap of 3 decades. So chikungunya was present, then for a gap of about 30 years, that is 3 decades, there was a pause, and again the chikungunya has re-emerged in the country. Government of India is continuously monitoring the situation since the chikungunya has re-emerged after a period of 3 decades. The Government of India is continuously monitoring the situation. The guidelines for the prevention and control of disease have been prepared. Since the vector which is involved in the transmission of dengue and chikungunya is the same, then the strategies for the transmission of risk reduction by vector control will also be the same. Since we saw that in dengue fever, the vector was controlled by chemical methods, personal protection, wearing full sleeved clothes, using repellents. Then we have environmental management for the source reduction, having this sprays, indoor sprays, using bed nets, insecticide treated bed nets. So these were the vector management which was done in dengue fever. The same vector management is followed in chikungunya fever, as the transmission is the vector which is involved in the transmission is same. For carrying out the proactive surveillance and enhancing the diagnostic facilities for chikungunya, the sentinel surveillance hospitals are involved in the dengue in the affected states will also carry out the chikungunya test. Like we studied earlier, for the proactive surveillance, okay, and to enhance the diagnostic facilities. So the surveillance centers, we saw the sentinel surveillance hospitals in cases of dengue, where the data will be collected and high staff will be assigned and they will detect the cases and perform the treatment. We also have the advanced laboratory centers. So these proactive surveillance and enhancing diagnostic facilities are available for chikungunya. The sentinel surveillance hospitals which is involved in dengue in the affected states, they also carry out the chikungunya test. Simultaneously, along with dengue, the chikungunya tests are also carried out by the surveillance hospitals, sentinel surveillance hospitals. They carry out the test for dengue as well as chikungunya. The diagnostic kits are provided through National Institute of Virology, Pune. So we have this diagnostic kits, like earlier we saw this NSI based ELISA kits and ELISA kits for the diagnosis. Okay, so the diagnostic kits are provided through the National Institute of Virology, Pune by the central government. Okay. So this was all about the chikungunya fever. When you watch the dengue fever video, we studied about the strategies wherein we studied the vector management and the sentinel hospitals, the ELISA kits, then ELISA based NSI kits which were introduced for the detection of the cases, IgM capture, ELISA test. So it is better you watch the dengue session, so that anything asked in chikungunya you can also write it, whatever is there in the dengue, because the vector which is involved in the transmission is the same. And also the sentinel surveillance hospitals which are involved in dengue affected areas, they are the ones who carry out even the chikungunya test. So everything is similar, and I hope it is clear. If you have any doubts, you can put it in the comment section, and if you like the video, hit the like button and subscribe.